Gentleman is recognized.
Obviously, this measure amends the Patient Protection and Affordable Care Act and seeks to repeal those provisions that establish and appropriate funds to the Prevention and Public Health Fund. It also rescinds any unobligated balance appropriated to the fund. As I listen to my friend from North Carolina, two things jump out at me immediately. One is her usage and the ruling Republican majority's House members' usage of the term for the affordable health care as Obamacare. I said earlier in the Rules Committee, I guess I could call it Hastings care, because I supported, as did many members of this Congress who are still here and some who are not, on both sides of the aisle, supported health care provisions for America long before any of us knew Barack Obama's name. When it's used the way that it is, it's in some manner attempting to be demeaning of the sole responsibility for the Affordable Health Care Act. I would assume some of that responsibility, and what I would say is he and many others in this body did not go far enough in that we did not establish universal health care for all Americans in this country. The other thing that jumps out on this particular matter, calling it a slush fund, and then allowing that it is going to be in the hands of an unelected bureaucrat. It puts us in a strange position in the House of Representatives when my colleagues with the ruling majority of the House of Representatives have sought and been successful to eliminate the opportunities for members of Congress on both sides of the aisle to seek to have appropriations earmarked for respective undertakings in their congressional districts. Rather, they would eliminate those earmarks and guess what? Put it in the hands of unelected bureaucrats. So I find it inconsistent to make the argument on one hand and then on the other hand say, oh, it's okay for the unelected bureaucrats to have some opportunities to spend our money. Quite frankly, I take umbrage with that. I think I can do a better job defining a need for a treatment plant in Belgrade than can an unelected bureaucrat. The burden of chronic diseases such as cancer, diabetes, heart disease, hypertension, and stroke present a significant public health challenge to all of our communities and our nation as a whole. In my home state of Florida, over 10 million cases of 7 chronic diseases, cancers, diabetes, heart disease, hypertension, stroke, mental disorders, and pulmonary conditions were reported early on in this decade at the cost of about $17.6 billion in treatment and resulting in $68.7 billion in lost productivity and economic costs. Simply put, we have a sick care system, not a health care system. Tens of millions of Americans are suffering from health conditions that could possibly be preventable. And this is further exacerbated by the continuing rise of health care costs. Despite the fact that chronic diseases are responsible for 7 out of 10 deaths among Americans each year, and that they account for 75% of our nation's health care spending, less than 3% of our health care spending goes to preventive health care services and health promotion. As you know, the Affordable Care Act, or the Hastings Care Act, or the Hastings and Obama Care Act, or the Hastings and Obama and Democrat Care Act, created the Prevention and Public Health Fund in order to assist state and community efforts in preventing illness and promoting health. The Prevention and Public Health Fund represents an unprecedented investment of $15 billion over 10 years to help prevent disease, detect it early, and manage conditions before they become severe. It aims to transform the focus of our system of care from primarily treating illness to maintaining long-term wellness by leveraging the power of preventive medicine. Through the Community Transformation Grants Program, for example, the fund empowers state and local governments and partners to implement community prevention interventions that help reduce chronic disease and healthcare disparities. In fact, the fund is already being used in all 50 of our states and the District of Columbia to prevent smoking, increase physical activity, reduce alcohol and drug abuse, increase immunizations, train the nation's public health workforce, prevent the spread of HIV/AIDS, and help control the obesity epidemic in our country. In addition, the Prevention and Public Health Fund provides funding for states to help develop a health insurance exchange by, note there, we should have had a public option, where consumers will have access to a new market of more affordable quality health coverage, as well as funding for up to 400 school-based centers in order to provide a safety net and improved access to care for children. Since the enactment of the Hastings Care / Obamacare / Democratic Care / Republicans Don't Care measure last year, the Department of Health and Human Services has awarded approximately $21.98 million in grants to organizations in Florida alone through the Prevention and Public Health Fund to help improve wellness and prevention efforts, including more than $9.3 million for community and clinical prevention, more than $3.1 million for public health infrastructure, and more than $9.4 million for primary care training. If we are to reduce health care costs, we must improve the health of all Americans. Investing in proven preventive measures can significantly reduce the risk of developing these diseases and improving people's lives and saving money. According to a report from Trust for America's Health entitled Prevention for a Healthier America, investing just $10 per person per year in proven community-based programs that increase physical activity, improve nutrition, and prevent smoking and other tobacco use could save our nation more than $16 billion annually within 5 years. This is equivalent to and potentially greater than the amount as estimated by the nonpartisan Congressional Budget Office, by which H.R. 1217 reduces direct spending over a 10-year period. Furthermore, a public opinion survey by Trust for America and the Robert Wood Johnson Foundation found that 71% of Americans favor an increased investment in disease prevention. The Prevention and Public Health Fund is also supported by nearly 600 national organizations, including the American Diabetes Association, the American Heart Association, the American Lung Association, Families USA, and the AIDS Institute. H.R. 1217, on the other hand, is nothing more than an attack on affordable health insurance, primary care, and safety net care for children. This bill is yet another feeble attempt by the ruling majority Republicans to disrupt, dismantle, and ultimately destroy the Hastings Care / Obamacare / Democratic Care / Republicans Don't Care bill one piece at a time, including those programs that have already been funded and are helping millions of middle-class, elderly, and working poor Americans and their families as we speak. The misinformation that pervades the health care debate in this country never ceases to amaze me at all. My friends, on the other side of the aisle, the ruling Republican majority would have the American people believe that the Prevention and Health Fund is a slush fund for the Secretary of Health and Human Services to spend money freely without congressional oversight. This is simply not true. A specific funding amount is allocated for prevention efforts through the fund each year during the fiscal period. $500 million in 2010, $750 million in 2011, $1 billion in fiscal year 2012, and so on, up to $2 billion beginning in 2015. This gives the Secretary, whomever she or he may be, under Republicans or Democrats, the flexibility and health care providers, or the funding certainty that the need to implement prevention and public health interventions that help Americans make healthier decisions for themselves and their families. The Prevention and Public Health Fund is the first and only federal program with dedicated ongoing resources specifically designed to improve the public's health. It represents our commitment to preventing illness and investing in our nation's long-term physical and... Let me say this, Madam Speaker. Every day that I awaken, I start my day by trying to figure what can I do to follow the scriptural mandate to help the least of us. I'm curious whether my friends in the ruling majority have the same feeling.